article.
That is a great point. I actually thought that the whole time. I was like, what biased information am I going to read in this?
Yeah.
It actually was so unbiased to me in the results and conclusions, I had to go into the media and talk about it. I couldn't believe it, what they determined. So this was a study done in March 2020, and Gilead took 53 patients who were seriously ill with COVID-19. And these patients were from Canada, America, and Japan.
Okay.
So 53 people, and they gave the drugs to them. The actual parameters were, we're only going to give them remdesivir for 10 days, and we're going to see what happens. Would you like to know what happened? I would like to tell you what happened, because I couldn't believe the results when they gave it out.
Were these people already hospitalized, or how far into their COVID were they?
They actually didn't mention if they were hospitalized or not.
Wow.
Just serious COVID-19 patients.
Okay.
They must have already been in hospitals to be determined to be seriously ill.
Okay.
All right, so summary of the adverse events. This is in Gilead Sciences' own research study from March 2020. 60% of the 53 people reported serious adverse events during follow-ups after the 10 days of treatment. The most common adverse events, now this gets better, the most common adverse events were increased hepatic enzymes, liver enzymes showing liver damage, diarrhea, rash, renal impairment, kidney failure, and hypotension. 23% had serious adverse events. The most common serious adverse events of the 23% of all 53 patients was multiple organ dysfunction syndrome. That's multiple organs are failing. That actual syndrome, multiple organ dysfunction syndrome, has been defined as the #1 cause of death from ICU protocols in American hospitals. Multiple organ dysfunction syndrome. Renal failure, septic shock, and hypotension. 8% of all of them had to be taken off the drug by day 5 of 10 because of such severe acute renal failure and multiple organ failure that they were going to die.
Wow.
They had to come off the drugs. So if you combine the 23% of those with serious adverse events of multiple organ failure and acute kidney failure, then those with severe issues of the same, you're up at 31% of all 53 people you gave it to. And these were the 2 studies that Anthony Fauci said warranted that that remdesivir was safe and effective, and now every hospital in this country is going to use only that drug and no other drugs.
Was there some spectacular outcome for the people who didn't have serious adverse events that made it say, okay, well, it looks like you might die. Like, see with Ebola, they say, oh, maybe you're going to die anyway. So if we have something that 60% of the time is going to save you, that might be one thing. But here we're dealing with fairly I'm not going to say non-lethal. People do die, but it's not like a majority of people die who get COVID. And yet, why would you take the risk of giving a drug that has such a significant consequence?
That's exactly right. So the one bias around the Gilead Sciences is that they're only treating with their one drug. There's no control group, and you're only giving these drugs. But still, you're reporting such high numbers of serious adverse events. Now, what was disturbing to me was that the 8% number of people who had to be taken off the drug at day 5 in Gilead Sciences' cohort study, that 8%, I actually went on the internet to look at World Meter, that keeps track of all corona cases for all the countries in the United States and around the world. I wanted to know in the United States, what was the percentage of treated COVID-19 patients in hospitals and deaths? And at that point, that same day, it was 8%.
Wow.
The drug-mandated treatment protocol by Anthony Fauci was, you're going to treat all ICU-treated COVID-19 patients in this country with remdesivir and remdesivir alone. Minimum of 5 days. You want to know where you got the 5 days from? The cohort study from Gilead 2 months earlier. So in 5 days, they had 8% of all their patients, just in that small group, that had multiple organ failure and acute kidney failure so severe that they were going to die. Now, I want to explain to you how I know what the problem is here.
Okay.
When you're listening to the media talking about hospital administrators and medical doctors who are up saying, as we're treating COVID-19 patients, we've never seen a respiratory virus ever attack the kidneys like this. We've never seen it. And we not only need ventilators, we need more dialysis machines. What happens when you shut down the kidneys with a drug, which now we know this drug, remdesivir, was proven to do it in 31% of everybody you gave it to who were seriously sick with COVID. When you shut down the kidney's main job is to excrete water from your body. All of these ICU-treated COVID-19 patients, like my father-in-law being treated with the flu, were on a saline drip, water drip, right? They're giving them water all day long, shutting down their kidneys in my father-in-law's case with vancomycin. Now they're doing it in ICUs with remdesivir, and as they pump them full of water, their kidneys can't excrete the water, then their abdomen retains the water then goes and saturates the heart, gets inside the pericardium sac, and then it goes from there and infiltrates the lungs. And you physically are drowning them to death. Just like in the case of my father-in-law, they actually flooded his lungs with water called pulmonary edema, and they drowned him to death by shutting down his kidneys. They also misdiagnosed my father-in-law with pneumonia, and it was actually pulmonary edema. Now what you're hearing in the media nonstop, and all the reports we're getting from patients in ICUs today who are dying, or medical reports after they've deceased and treated in ICUs, it's the same things put on every single death certificate. Death by COVID-19 infection, with severe acute renal failure, kidney failure, and secondary COVID pneumonia. And I am begging everyone in the world to demand that your loved ones in ICUs demand the medical doctors do the sputum test to find the bacterial and viral pneumonia. If it's not present, it is acute kidney failure resulting in fluid accumulation in the lungs, water retention called pulmonary edema, and they are drowning your loved ones to death. And they know how to do it in 5 to 10 days per these studies. Now, what's also miraculous is America represents 4.5 of the entire percentage of the population of the entire world. We represent 4.5% or so. of the entire world's population. By the end of 2020, we had more deaths in the entire world from supposedly COVID-19 than any other country in the world, at 550,000 Americans dead.
Was any other country following our protocol?
No. This is what's amazing. So when people ask me, why are you so upset? And I'm like, Anthony Fauci in May of 2020 asked our federal government to buy up all the stock of this experimental drug of remdesivir and not to share it with another country until the end of 2020. So we were the only country in the world treating patients with a proven multiple organ failing drug, acute kidney failing drug, and we were the only one doing that in all of our hospitals, treating all Americans with it, and we had the highest death rates. I'm convinced that 90% of everybody who died from COVID-19 did not die from COVID-19 infection. They died from acute kidney failure, renal failure, leading to pulmonary edema, misdiagnosed as secondary COVID pneumonia, and it never was that. And they're still doing it
Are
a
you
year,
still
year and a half
using
later.
remdesivir?
This is still the only treatment protocol. And we're getting reports all the time now, because I'm in the media all the time talking about, keep your loved ones out of ICU. They have this murderous cocktail that they're using to destroy you. And now that it comes to the Delta variant, if I could touch on this for a minute,
Sure.
people ask me, why is this Delta variant so much more deadly for the healthy and unvaccinated people in hospitals? And I've stood up on stage on multiple speaking engagements and I've said, all of you who have loved ones in ICU, I need you to pay attention. They already knew that remdesivir, in combination with a steroid called dexamethasone, which is what they're only doing in hospitals, all ICUs, per the NIH right now, those two drugs in combination actually cause acute kidney failure in 35% of all people you give it to. I said, if you want to know how it is they're making all these people sick and dying that are healthy in ICUs, all they have to do is add another drug. All they have to do is add vancomycin, that antibiotic that is deadly that killed my father-in-law. I said, demand the medical records of all your loved ones who have died or are being treated in ICUs. I guarantee you they've added vancomycin. Since I've started speaking that, every day we get multiple medical reports from patients who have died since April of this year, 2020. All of them include the three drugs, vancomycin, dexamethasone, and remdesivir, for 5 to 10-day treatments.
But do you think the ICU doctors are complicit, or they're just following protocol and they don't understand it?
Great question. Do I think the medical doctors are complicit in this?
The attending one, I'm talking about the frontline
Yeah.
ones who are right there. I mean, I would have a hard time thinking that universally they're all just going to say, yeah, we're going to be complicit in the murder of all these patients.
Absolutely. So I actually have stated this many times. People have asked me this many times in interviews, and I've actually told them in the beginning, for like maybe the first 3 months, I will grant them ignorance and the demand get put on them by their employers, the hospitals, to follow just these federally mandated protocols. And I really do believe they would have just trusted their employers, these hospitals, and just done what they were telling them to do.
Or they trust the CDC.
Or they trust your federal agencies, right?
You know, listen, we got a new infection. You know, this is our governing bodies that basically are supposed to give us information to tell us what to do. So to me, it'd be like, as a matter of fact, they might be, they could have adverse licensure action because they're not within the standard of care as recommended by the CDC for an infectious disease.
Yeah.
So I could see that, but then where do you think it goes from there?
Well, it's been a year and a half almost now. I think they've taken a Hippocratic oath to do no harm. They should have had plenty of time in the last year and a half to do some research into why it is we as an American country, our healthcare institutions of the great United States of America, why in the world are we still having death rates higher than any other country in the world? Why don't they look back? Why don't they step back and go, what are we doing to every patient? Is there something different that we could do? Well, I would love to tell you there's something you could do differently, because in September of 2020, France decided to do a little trial with remdesivir on just 5 French people that had COVID-19. And they wanted to see what happened with remdesivir. And I'd love to share with you the results of that little study.
Go ahead.
Because it was miraculous. This is in September of 2020, 5 months after that, okay? Still, in September of 2020, remdesivir was not an FDA-approved drug. In the middle of the pandemic, now that we'd killed 500,000 people with that drug in America, at the end of October 2020 is when they got the FDA approval for remdesivir. So there was it's titled, Remdesivir and Acute Renal Failure. In September of 2020, this is the case report study done by the French in France. This was actually done by I'm going to butcher it, Boucher Claude Bernard University Hospital in Paris, France. And they took severe pneumonia-related SARS-CoV-2 treated patients.
Okay.
So they had severe SARS-CoV-2 pneumonia. The brilliance about this, though, is France said, we're only going to do 5 patients. And what they decided is they were going to give them 14 days of remdesivir because there's this American country just using remdesivir. Let's skip it to 5 people. And this is what they found. Remember, they wanted to do it for 14 days. Remdesivir was interrupted before the initially planned duration in 4 out of the 5 patients. They had to stop remdesivir. They couldn't even go to 14 days. Because of alanine aminotransferase elevation. This is called ALT on blood work. They found that ALT levels, which is liver enzymes showing liver disease and toxicity, they found that ALT went up 3 to 5 times the normal numbers, which were normal before they started remdesivir. Within those 14 days, they found it elevated to 5 times the normal dose or levels. 2, because of renal failure requiring kidney transplants.
Whoa. And how many of them?
This is 4 out of 5.
So four out of 5 required a kidney transplant?
Yes. So the actual numbers were this. They found elevated liver enzymes that were 3 to 5 times normal, toxic levels of liver disease. And then they had 2 of the 5 who had to actually stop the drug because their renal failure was so great they had to get a kidney transplant.
Wow.
And this was their conclusions. They said, this case series of 5 COVID-19 patients highlights the complexity of remdesivir use in such critically ill patients. Guess which drug France decided not to use?
That only makes sense. So they stopped using it. I mean, they never used it, I guess. They tried it.
Yep, they tried it on 5. 2 of them died during the trial, during the 14 days. 2 of them did. That's 2 out of 5.
2 out of 5.
Yeah, so what's your percentage there?
Yeah. Wow.
These are horrible numbers. So I just want you to know it's not only that America...
But that sort of cooperates with the earlier study showed.
When Anthony Fauci said, we're going to now mandate this and give it to every American without question, and then quoted 2 studies that he said proven safe and effective against Ebola, proven safe and effective for COVID-19 patients. No, it wasn't. It was found to have a huge amount of acute kidney failure.
So has anybody put these questions to Fauci? In other words, this is published. I mean, it's searchable,
published.
right? Anybody can see
Published,
it.
yeah.
Again, these frontline doctors, I mean, I don't know, I could follow all the way saying that they're all just in every hospital in America complicit in wanting to kill people. I think maybe there's some evil people like that. I can't imagine all of them just decide to turn murderous. But nonetheless, this data is available for anybody to observe.
I would like to highlight on another published review. Okay. And you can find this stuff. Just type it on any Google search, DuckDuckGo search. I don't care where you go. Just type in remdesivir acute renal failure WHO, the World Health Organization. Okay. All right. Now this is dated April 2021. So we're in September. It's only like 6 months ago. There was a data review within the World Health Organization of people treated for 4 different types of drugs for the exact same severity of COVID-19 symptoms or disease around the world.
Okay.
And this is what they wanted to do. They were looking for reporting odds ratio. They wanted to compare the number of acute renal failure cases reported with remdesivir with those reported with other drugs prescribed in comparable situations in COVID-19.
Did they have any controls to say if we don't get many drugs, does kidney failure occur? Or,
Not for this. They wanted to just take drug treatment patients around the world with 4 to 5 different drugs.
Okay.
And they were all at severe levels of disease of COVID-19. So this is what it was. They wanted to look at reporting odds ratio, comparing the number of acute renal failure, renal means kidneys, renal failure in COVID-19 treated patients with those with remdesivir compared to those being treated with hydroxychloroquine, which is what Anthony Fauci said was dangerous. Don't give it to people during COVID-19. Tocilizumab and lopinavir, or another word for it is ritonavir. These drugs. The combination of the terms acute renal failure and remdesivir yielded a statistically significant disproportionality signal. The ROR, or reporting odds ratio, with remdesivir for acute renal failure was 20-fold that of other comparative drugs.
Wow.
Including hydroxychloroquine. 20-fold. Then they quote, we detected a statistically significant pharmacovigilance signal, drug-induced signal of nephrotoxicity or kidney toxicity associated with remdesivir, deserving a thorough qualitative assessment of all available data. Assessments of patients with COVID-19 renal function should prevail. So they're saying here, the assessment of renal function should be imperative to evaluate before and after you start remdesivir treatment for COVID-19 patients in America. This was 5 months ago.
Wow.
It is still on the NIH's website, even this morning. It is still the only mandated drug is remdesivir, with dexamethasone, a steroid. And now they're combining that with an antibiotic, which, by the way, for all your audience, antibiotics, the CDC says, are unwarranted in viral infection diagnoses. They cause more harm than they do good.
So
So why would you throw vancomycin in there? Why would you do that when the CDC tells you not to do that? So go look it up. Look up CDC, antibiotics warning for viral infections. You'll see it. So with all this information, all you know now, every time you see a death certificate for patients in America, you're seeing death from complications of COVID-19, followed by acute, severe renal failure, and secondary COVID pneumonia. Acute kidney failure leads to pulmonary edema.
Is there any data on untreated people that had severe COVID to see if there's any renal problems?
This is great, right? So in America, you're not going to find any of those because what do they tell all serious sick people with COVID-19?
Go to the hospital.
Go to the hospital. And where did 100% of all the patients in America die with COVID-19?
Yeah, in the hospital.
In ICUs. What were they doing to those people in ICUs?
Incidentally, is that something?
Remdesivir.
Is that something you verified? 100% of people who died from COVID did it in hospitals. There are no home deaths.
Yeah.
I guess maybe they can't be tracked.
Yeah, that's going to be very hard to track, but
Yeah.
you would only be able to find that on the death certificates written by their coroner if they came to your house or the attending doctors there in the hospital.
Yeah, but I would imagine people who got very sick ended up in a hospital for the
For
most
sure.
part. Yeah.
They're still going there right now. Like they're all still going there feeling like they need to go there. When in fact, it's already proven that the drug Anthony Fauci chose to be the mandated drug before he chose it It was already chosen to be and found to be the most deadly of the 4 experimental drugs in the Ebola trial.
So with the FDA, when they approved it, was the intended use for treatment of COVID-19, or how did it get approved?
I have no idea
Yeah.
why they would have approved that in October, except for the fact maybe they heard me in the media screaming about how dangerous it was since May 2020. I literally went into the media on every news outlet you could think of, making sure everybody knew that this drug was the reason all the doctors in New York at the time were actually stating we're seeing acute kidney failure in 3 to 5 days. No kidding.
So if someone has a loved one that gets into the hospital, can they demand that they don't use this drug, and would the ICU comply with that?
So we're finding a ton of ICUs and medical doctors there are telling, and administrators are telling their patients they're not doing anything else other than the mandated federally protocol for remdesivir and dexamethasone. But what we have learned is, if you are coherent and you can tell them you're not putting remdesivir inside of me, you can threaten them with battery if they still do it because you told them up front not to do it and you're not going to allow them to. You can call 911, file a police report, and file battery charges against the doctor. You should also audio record the entire conversation. That's if you're coherent. It's very unfortunate, but we have thousands of people emailing me, personally, the chiropractor, every week, asking for me to step in as a patient advocate to get the ICUs to change their mandated protocols as they're finding out that their loved ones are failing and going into acute kidney failure, and they're being treated with remdesivir, the exact thing we've been teaching them about, and they're seeing the exact same scenario. So we're educating on everybody how to either hire private patient advocates if they can't speak of it confidently on their own, the chain of commands of those individuals. There are ways to do that. And then there are legal things you can do. For example, there was the Right to Try Act. You can actually file a temporary restraining order against the hospital for not trying additional treatments on top of what they're mandating right now. For example, just like in the case with my father-in-law, one of the horrible things they're doing in ICUs, as these individuals are going into renal failure and then being put on a vent,